is delivered either by the nebulizer or one of the puffer forms. These are often referred to as puffers or inhalers or MDIs, which is short for meter dose inhalers, and this is the spacer. A lot of times you'll see people use the inhalers, and TV ads and things, you'll see them shake it up and put it right to their mouth. Unfortunately, when you put it right to your mouth, it really doesn't work very well. If you take one of these, and this one's just about out, so I'm not sure it's going to work, basically it shoots about that far. And so when you put your mouth right to this and puff it, almost all of that medicine is hitting the back of your throat and not going down to where it needs to go. In order for it to work, it has to come in here, take a turn almost 90 degrees down to your chest, come all the way down the tubes and go out to the small air tubes. And that's what the spacer is used. In an adult who's able to fully cooperate, the technique is pretty simple. You shake it up good. The medicine inside that canister settles out in about 10 seconds, so you'll want to shake it every single puff. So shake it up, you blow out all your old air, put it in your mouth, puff it, take one slow deep breath in and hold it for 10 seconds. When you take that breath in, it gets the medicine down to where it's supposed to work, and then you hold your breath so that the little particles will fall out into the airways where they need to work. Well, especially for a lot of the kids, they're not able to follow those directions completely, and so there's some modifications that we can do depending on how old they are. In a newborn, we've shown that we can deliver this just as well as the nebulizer forms, and what you do is shake it up good, put it on their face, puff it, watch them breathe in 6 or 8 times. That's one puff. With albuterol, you always wait a minute and then you do your second puff, and we usually do them in 2 puff groups. But in some children who are older and can cooperate but not do the whole technique, you can do your shake and just have them put their mouth on here, puff it, have them take 6 or 8 breaths, and that in itself would get the medicine where it needs to go. If you can start trying to have them take a few deeper breaths, maybe even holding it for a little bit longer, that would get the medicine in even better. Albuterol is albuterol, and it really doesn't matter how you get it, whether it's the nebulizer or the puffer and spacer. As long as it gets down to the lower airways, it will do the exact same thing. A lot of people believe that the nebulizer is more potent. Most of the time it's a matter of timing or it's a matter of dose. The nebulizer takes 12 to 15 minutes to deliver, and so most people are looking to see whether or not that they get the benefit as soon as they finish. Well, by the time that the albuterol nebs finish, some of the medicine that went in at the beginning of the neb is already reaching peak effect. Whereas with the puffer and spacer, that takes about 30 seconds to do, and that medicine is going to peak in 14 minutes after you finish versus just a minute or so after you finish with the nebs. If you started both at time 0 and looked at them at 15 minutes, then I think that you'd be more impressed that they're equal. I like the puffer and spacer. 1, it's a lot faster. 2, it's portable, so you can take it with you wherever you go. And 3, is easier to adjust to the dose that you actually need. 6 to 8 puffs is about the same amount of medicine you would get in 1 neb. But if all you needed was 2 puffs, you could stop it at that point. When we're using albuterol by the puffer and spacer, you do your shake, you do your puff, let them breathe in, hold it for 10 seconds or take multiple breaths if they're not able to cooperate with that. Wait a minute, do your second puff. Then we give it about 5 minutes, or excuse me, we give it 1 minute until the next puff, and we do it in 2 puff groups. After you've done your 2 puffs, you give it about 5 minutes, and if you're all better, you stop at that point. If not, then you give 2 more puffs. Give a puff, wait a minute, give your second puff, and then you can wait another 5 minutes until you get up to the 6 or 8 puffs. And if you do it that way, you should be able to get in about as much medicine with a puffer as you do with a nebulizer in about as much time.